Hello, everybody. My name is Raven Tatum. I'm from the Mighty Tall chapter. My pregnant sister complained to her provider that she was feeling short of breath, and they dismissed her concern and sent her home. According to the CDC Hear Hers campaign, this is an urgent warning sign. If this happens to you, learn from our health experts how to advocate for yourself.
People really need to start building their village. That's going to help in terms of taking care of mom and baby after the baby's physically here, but having your go-to support people, whether that's a partner or a spouse, or do you have a close sister or friend or someone really there to support you that can be a sounding board to say, these are my concerns, they're not being met, how can we approach it, just to kind of come together as a community to say, how do we advocate for you? More women are utilizing doulas as another layer of support, and that live time advocacy in either the birthing center or in the hospital or coming, it's sometimes a little bit limited now because of appointments and the pandemic and who you can have there. But I do feel like doulas have been a force in the community and another level of advocacy.
You really do have to let them know you're not there just because you want to be. People don't choose to come in to bother the staff. And I think sometimes we are in a position of being submissive and respectful. So if they say nothing's wrong, we tend to believe them and we go home and we follow instructions. But sometimes when you've done all you've been told to do and something is just not right, you have to stand firm and insist that another look be taken, something else be considered. Because people typically know when there's just something that doesn't seem right or feel right.
Start out by saying, I'm concerned. I feel that something is not appropriate that's going on here. I'm very concerned because my wife is not breathing. Or I'm concerned because my wife or girlfriend seems to be bleeding more than she should. She's soaking pads. I think when you say I'm concerned, even for us, as a level of, a level of the chain, going up the chain, those are the things that we should use, words that we should use in order to wake someone up, to make sure they hear your concern. And once you start talking about I'm concerned and you start telling the person who you're discussing this with how you feel, let them know that no, this is not typical. And I would like to get an answer from someone, perhaps the physician that is on call or my attending that has been seeing me throughout my visits, throughout my care here. Please let them know that I need to voice my concern.
Systems are in place, and sometimes it's you against the system. And if you don't have an advocate there can be a problem. So I think when you are not being heard, it's important to also bring an advocate with you so that they can also voice your concerns, and so that someone else is hearing what's being told to you and also can say, yeah, that doesn't sound right, and we need to have more done in this situation.
Don't give up because the process may take a little long or the situation may be hard. We as individuals are to advocate for ourselves and take ownership of our bodies and what is occurring related to childbirth and the postpartum period.